Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachowa with PAR5 Physical Therapy here in Randolph, New Jersey, and I've partnered with them to bring you an easy and educational workday session. Today's session, we're going to be going over foam rolling of the upper and the lower back. A little bit about me. I'm a physical therapist. I've been in the PT field for over 20 years. I'm a certified orthopedic clinical specialist and certified by the Titleist Performance Institute as a golf medical professional. So last week, I guess, let me get my slides up here. We went over foam rolling 101. Today we're going with foam rolling 102, the upper and lower back. So just as a reminder from last time, we covered the different densities and hardness of foam rollers. The harder is a little bit more aggressive. You're able to get a lot of shearing and a lot of soft tissue work done. And the softer ones on the other end of the spectrum, they're a lot more comfortable, but might not be as effective as the harder ones. So you want to pick your poison and pick a density that is comfortable, that you can tolerate. We also went over the proposed effects of how foam rolling affects your body. We have this compression, this pressure gradient as you move over the foam roll, which moves fluid around the tissue. We also have a shearing effect of one level of tissue moving over another level of tissue, which creates more mobility through that fascia, looseness through the fascia. And we also have the neuromuscular component, where applying that deep pressure and accompanying that with breathing techniques, we could reduce the tone of a muscle, basically take it from being super tight and hard to being loose and supple. All right, as always, I have to give you the little spiel here about this is not physical therapy, it's not medical advice. It's just general information for a broad population. So if you're dealing with something specific, make sure that you consult a medical professional to develop a customized plan that's suited for your needs. Okay, so we already went over the review of foam rolling 101, talked about the circulatory system, circulatory effects, the density of foam rollers. And then my next slide here is basically how we start and how we perceive the body. The body moves or functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is usually the result of this. So for the lower and upper back, we're looking at the lumbar spine, the lower back, that's supposed to be stable. And then we have the thoracic spine or the T-spine, which is our upper back, and that should be mobile. So we've got two different roles and two different segments. We want to make sure that we keep the lower back stable. It doesn't like to rotate. It likes to forward bend and extend backwards. It likes also to side bend. It doesn't like to do rotation. The thoracic spine, on the other hand, there's a lot of rotation that happens in that. Okay? So we're going to go over some foam rolling for the upper and lower back here. I'm going to pull up my other camera. We're going to get into it. So hopefully you have a foam roller at home or at your work so that you can kind of follow along. So we're going to go over the thoracic spine and the lumbar spine. So I'm going to take this camera back down so you can kind of see this angle. I've got my foam roller down here. What I would like to start with is a very gentle stretch through the chest and the shoulders. So you're going to lie this down, and then you're going to lie on top of it lengthwise. All right, let me close this door so we don't get disturbed. But basically, you're going to lie down, you're going to sit right at the end over here, and lie back straight on. Okay, so I've got my pelvis, my hips all the way at the bottom, and this 3 feet long foam roller should fit most people. If you can't get your hips or your head on the foam roll vertically like this with your knees and feet, your feet flat with your knees bent, then we might have to get like an extension, maybe get 2 of these, or if you have a shorter one, you probably need to have this long standard one, which is 3 feet long. All right, and then from this position, all we do is just take the hands palms up. So that's key. Hopefully you can see this in the camera here. We've got the palms up, the back of the hands onto the floor. And then we want to just work on breathing. Just in and out through the nose, a 2-second inhale and a 4-second exhale. That 2-second inhale and 4-second exhale will help relax your nervous system and allow all this stretching and soft tissue mobilization that we're going to get done today more effective. As you feel comfortable in this position, we start to slide the hands up, keeping the back of the hands on the floor. And as we slide the hands up, we should start to feel a stretch, a gentle stretch through the front part of the chest and shoulders. And again, continue with your breathing. In 2 seconds, out for 4 seconds, all through the nose. You could pause your breath as needed at the top or bottom of your breath, and then you kind of just progress all the way up here. At some point, the position might feel a little uncomfortable, or the stretch might be a little too strong, or you lose contact with your hands on the floor. So wherever you feel that happening, we back off so that we can maintain a comfortable position. So I usually recommend at least a minute to a minute and a half in these positions to allow your nervous system to relax and your muscles to relax and elongate. Okay, so we don't want to go rushing through these where we start to go really, really fast and skip a lot of steps, because then we get the stretch through the tissue, and then as soon as we get out of this position, they adaptively come back into a shortened position. So this is a good exercise and stretch to kind of counteract what our posture and positions are throughout the day. So you can kind of imagine, as we're working throughout the day and as we're using stuff in front of us, even just sitting, we get into this slouch position where our shoulders come forward and we're manipulating things with our hands. So this stretch, this position really helps to open that up. So we opened it up vertically like this. Now we're going to try and work horizontally into this upper back. Okay, so for that, we're going to roll this lengthwise or horizontally and lie on it like this. So the first thing is I'm going to have my knees and hips bent here, feet flat on the floor again, and I'm going to put this on my lower ribs. Okay, a lot of times people are like, oh, this is too much pain, so I'm going to start in my mid back. That's fine, right? But what we're going to do is we're going to take your hands and support yourself behind your head here and interlock your fingers and bring your elbows together. And when you bring your elbows together, what that does is take the shoulder blades and moves them out of the way so that we expose more of your ribs, your mid-back, to this mobilization. So we're going to start with foam rolling our mid-back. And to do that, we maintain that hand and elbow position. We're going to lift the hips up, and then we're going to go up and down. As we go up and down, we can reposition the feet as needed, right? I'm in my mid-back right now, rolling through probably 4 to 6 inches of space through there. And then I'm going to move my feet and then get my lower ribs. So now I've got another 4 or 6 inches of path to travel through here, right? So I'm going to take my time, again, a minute and a half, even up to 2 minutes of foam rolling, because we've got a bigger body part here that we're working on, right? And then we can kind of go all the way up to the middle part of your shoulder blades as well. Get those shoulder blades out of the way, lift the hips, and kind of work through there. Now, because our torso is like a barrel, we also want to get maybe a little bit to the left and a little bit to the right, so we can start to lean or rotate one side and go up and down so that we've got one side of the spine working, or rolling to the other side and then getting the other side of the spine. All right. Now, the big question that I get for people is that when we're rolling the mid-back here, can I do this on my lumbar spine? There are practices that put this right onto your lower back and then lie back. But a lot of times, this can become uncomfortable for a lot of people because of this raised position. So you can kind of get through here a little bit, but it can be uncomfortable. So what I suggest is not using a foam roller, but using something smaller, like this lacrosse ball. And a tennis ball can also be effective, or even a baseball. We're going to place this right in the lumbar spine area, but not on the spine itself. We're going to go off to the side. So I'm going to assume that same position. I'm going to be lying on my back. I'm going to place the ball above the pelvis, but to the side of my spine, and then I'm going to get into that soft tissue there. The principles are the same, though we're going to still work on our 2 to 4, 2 second in, 4 second out breathing pattern with our nasal breathing pattern, and then allow our back to kind of shimmy side to side, lifting the hips if you want, moving your hips forward and back or back and forth, or moving yourself up and down. So it's not a big movement. It's really when you're trying to relax muscle, you have to go slowly through these tissue spots. So we're going to go nice and easy as we go through these, and nice and slow. Another technique that I like to do is if you find like a very acute trigger point where something is like, oh, this feels super uncomfortable and tight, we don't want to press on it so that it creates a lot of sharp pain, but we do want to release that muscle. Another technique is to just hold that trigger point down with the ball and move the leg, the knee, in and out gently. And that'll increase the pressure on that ball and back it off. So we can kind of pump that fluid in and then pump that fluid out, kind of creating that pressure gradient as well, as we mentioned last week. And then as you get comfortable with that, we can increase the pressure on the ball by bringing this knee into your chest. As you bring that knee into your chest, that should increase the pressure on the ball, and you can come off of that as well. So that should be a good stretch to your lower back, in addition to that trigger point release and that soft tissue mobilization that we get through with the lacrosse ball. Okay? So the other thing I want to touch on is mobilization to your mid-back. We come back onto our previous position here. So we went over this position, this movement, as you're going forward and backward to address the soft tissue. But another technique that I like to use to counteract our daily positions of being hunched over and counteracting that posture is to work on extension over this foam roll. So what we do is I want to start on the lower ribs. So we want to, if you feel your ribs here and then it's lower than, or the foam roller is higher than that, you want to be able to scooch up and then really make sure that we are on our lower ribs. And then we're going to get the hands, interlock the hands behind the head, elbows forward, and then we're going to take the head and shoulders and we're going to rock back. And at some point, this might feel a little uncomfortable, and you just kind of stop before that and come out of that. So we're just going to go back into extending or stretching the spine backwards and then coming forward. The big thing with this is not kind of letting yourself totally flop. We want to have some tension through the abdominals so that when we do go back, we're not borrowing this motion. We're getting it from only the lower back, and I can just go all the way back if I let my belly go, let my abdominals turn off. I wanted to make this very specific to that 2 or 3 segments of spine that's on the foam roller. So I make sure that this stays stabilized, my core is on, and I'm just kind of doing a little bit of a seesaw over that segment. Mostly thinking about taking my shoulder blades, my head, and my shoulders straight down to the floor instead of arching and going backwards. Okay, so the visualization is straight down to the floor. After a couple of times at that segment, I'm going to lift my hips and scooch myself down. So I roll that foam roller a little higher, so I get to the next 3 to 5 segments, and I repeat the process. Again, trying to keep my abdominals a little bit engaged so I don't hyperextend my lower back, and I get this through that mid-spine, that thoracic spine. And this is a good one if you're feeling like super tight and super rounded and hunched over. Sometimes if you're really tight, you might even feel like a crack or two when you do this. And then again, I'm going to come up and then repeat. And we continue to do this all throughout the thoracic spine and pretty much until you get to about the middle or upper shoulder blade height. All right, so I'm going to come up to that level right now. So here the foam roller is very close to the top of my shoulder blades. I'm not getting that much of a mobilization now. It doesn't feel as effective. So what I can do is I wish I need to add more body weight on the other side of the foam roll. So I'm going to take my hands, interlock my fingers out this way, and see if I can oscillate into this position, going back like this. Just a couple times again, because the head is unsupported. This might be difficult for some people to hold their head in this position. So a couple times, you're going to get out of that. All right. So that's foam rolling for the lower and upper back. thoracic spine, the lumbar spine, a couple stretches that you can do to follow up this, because once you mobilize and mobilize the joints and work on that soft tissue, we want to be able to utilize that and feel a little bit better as we lengthen that tissue. So right after I usually do the foam rolling, I follow this up with some gentle stretches that I borrowed from yoga. We're going to take this quadruped position, basically the knees below the hips, hands below their shoulders, and then introduce motion to the spine, sagging the belly to the floor, tilting the pelvis downward, and raising the head up, and then reversing that, tilting the pelvis back, rounding the lower back, rounding the mid back, and the head coming into the chest to round out the spine. So we just do a couple moves of that, arching or sagging the back, and then rounding, and then going down. All right, once we introduce this and it feels nice and loose, you can go into a child's pose, basically opening up the knees a little bit, dropping my hips down, and then reach forward, head goes to the floor. Again, a couple breaths in this position, in and out through the nose, 2 seconds in, 4 seconds out, to stretch that area. Then we can also walk the hands over to the left to stretch out the right side of the trunk. Again, breathing slowly, trying to inch into that stretched position, go gently and softly. And then repeat on the right side, stretching out the left trunk. And this, from this child's pose position, you can walk the hands forward to get the extension. So I'm going to sag my hips down into the floor, and then head comes up. All right, so you can kind of see that. Rock back here, you can see that camera. So we're here and going into extension. And we can kind of oscillate between both positions, totally flexing the spine and then totally extending it. All right, so making sure that we have full range of motion physiologically available to us after we stretch out and mobilize with the foam roller.